This is Patricia Bentkowski, nursing 240, doing a wound dressing change, dry wound, dry dressing change with PPE. So to get started, first, before I don my PPE, I'm going to verify my physician's order. What needs to be done? Clean chest wound daily with normal saline and apply dry sterile dressing. Okay. So then what I'm going to do is go into my supply room. Well, if I'm wearing PPE, most likely it's because my patient is on precautions. So I probably should have my supplies in here. But for all intents and purposes, I'm going to get them. So I gathered up my supplies, okay? Just for good measure, I'm gonna wash my hands. I'm gonna don my PPE. I'm gonna start with my gown. Of course, I'm not doing this in the patient's room. I'm doing it outside their room. Back. The easiest thing to do. Okay. And I'm going to put on a pair of clean gloves. First, before I do that, I'm going to put on my mask. Pinch the nose and pull down so it's over my chin. Pinch the nose so it's secure. Now I'm going to put on my gloves. Pair of clean gloves. I'm going to make sure it goes over the cuff of my gown so no skin is exposed. Okay. I'll bring my supplies. Knock, knock, knock. I don't have anything behind me, so for all intents and purposes, there'd be a bedside table, a stand behind me. I'm going to pretend it's here. So I put my supplies. I go in. Hello, Mr. Smith. My name is Trish. I'm a Duville student nurse. I'm going to do your dressing change for you today. Could you verify? I'm looking at the patient's wristband. Could you verify your full name and date of birth for me? Okay, great. Okay, thank you. Before we get started, let me ask you, are you in any discomfort and pain? No, you're doing good? Okay. Um, do you have any allergies to latex? And you would know this if if you're allergic to shellfish, like shrimp or, no? Okay, good. Okay. And I see the physician order again is in his room, so I'm making sure again. Okay, so what I'm going to do is I'm going to make sure he's at my height. I'm going to raise up the bed. I'm going to lower the bedside rail. I'm going to make sure the trash can is right here now. Now here is going to be my work area. So I'm going to make it here. Um, And the first thing I'm going to do is I am going to check the wound. We're going to take off the old dressing. Okay, good. Throw it in the garbage. Okay, looks good. You assess it using ARETA. Area, redness, edema, ecchymosis, drainage, and wound is approximated. And everything looks good here, and there's no dehiscence. Okay, so now we're going to go ahead and begin. I have everything at waist level, my workstation and the bed. Anything below my waist is not sterile. Above my waist is sterile. I cannot turn my back to my patient or to my table, because that breaks sterility. Okay, so what I'm going to do is clean the table with sand wipe. And there's a barrier here. I put a piece of tape and I cut 3 other pieces. And I already dated one with my initials, date, and the time I'm doing this dressing change. Okay, so the next thing I'm going to do is get my supplies and put them on my table. I have normal saline. I've checked the expiration. I've checked the contents, make sure it's the correct saline. It's not cloudy. I don't see any particles in there. And a sterile cup. Okay, so now what I'm going to do is I'm going to just because I'm going to take these gloves off. Wash my hands again. Because I'm wearing PPE, I have to put on another pair of gloves. Oops. Of course, in a regular setting, everything would be fine. Because I'm doing this one glove broke. Okay, again, make sure they're over my cuff so that no skin is exposed. Okay. So now what I'm going to do is I'm going to start with my sterile field. I've got my sterile package, which is hard to do with gloves. That's got it. You still doing okay, Mr. Smith? Yeah. This won't take long. It's just setting everything up. And then it'll be over. 1, 2, 3. Just got to get this package open somehow. There we go. Okay. So I open my package. I put it on my table. I pick it up by a corner. Well, that didn't work out good. So now the side that I'm talking into is going to go face down. I have 1-inch borders. I have 1-inch borders all the way around. And I do not want to cross over it or uh, or anything below. Okay, so now what I'm going to do is I'm going to open up an ABD pad, and I'm opening it away from my sterile field. There we go. So I'm opening it up. And I am going to drop it on top of my sterile field. Okay. In the garbage. Whoops. I should have just let it drop. I'm not quite sure if it went below my waist or not. But if it did, I would have to start the procedure over. Now I'm going to get 3 4x4s and open them up. Same thing. I'm going to drop them on top of my sterile field and just drop it. Okay. Now I'm not crossing over my field. I'm just going around it. I'm checking my saline, making sure it's the right saline and it's not expired. It's not cloudy, has no particles in it. And then I've got my sterile cup, which I'm going to take off the cover. And if I had the stand behind, I would just put it over there, but it's over here. I'll put it here. And I've got the 1-inch border. I'll put it right there. I'm going to take my saline. And I'm going to put some in here. Cover it. Put it in my workstation. Okay, now the next part is my sterile gloves. So I'm going to take off my clean gloves again. Now I don't think I quite went below. Wash my hands before I put on my sterile gloves. I'm going to put on my sterile gloves. Open up my package. Making sure it doesn't go past the 1-inch field. I'm going to pull them apart. Now I'm going to pinch the cuff with my one hand and get my hand in here. At least that far. And then I'm going to use the scoop method. Making sure not to use my thumb. Oops, I use my thumb. But try and you don't want to use your thumb. You want to keep your thumb away. Get this on my hand. So it's sterile to sterile now, my gloves, so I can work them. Make sure they're over my cuff. No skin's exposed. I have a small table, so it's I realize this looks like it's over the 1 inch border, but it's really not. But if it did go over it and it touched the sterile field, I would have to start over. Okay, so what I'm going to do is I'm going to take one 4x4, going around my field, dipping it in my saline, coming back around, and cleaning the wound. Garbage. I'm going to get the other one. Same thing. I'm going to go around my field, dip it in, come back around, and clean that side. Garbage. Then I'm going to go over my field. Well, not over my field, but I'm going to, this hand's still sterile, so I'm going to put this over the wound. Then I'm going to pick up my ABD pad, put it down. So it's done. I don't have to worry about the sterility anymore. So get my tape. Sorry, Mr. Smith. And the one with the date. Okay. Now, I'll throw everything in the garbage. Get everything. And now, I will get rid of this. So how was that, Mr. Smith? Did that do okay? Feel better? Okay, good. Okay, I'm going to raise the rails, lower the bed back down, make sure his call light's within reach. And so now I'm going to go in the outer area of his room near the door, and I'm going to take off. I think that's called doffing. Putting on his donning, taking off his doffing. So what I'm going to do is I'm going to take off my gloves first. I'm going to pinch them here in the middle. And then I'm going to take my 2 fingers underneath the cuff. I think these are too small. And that's that. Throw them in the garbage. Now I'm going to go ahead and, well, I shouldn't have touched my, I'm going to take it off because the back is sterile. I mean, it's not contaminated. And I'm going to take this right here under the cuff, use my sleeve, pull off my other sleeve, and take it off, so that it's inside out. Put that in the garbage. And then I'm going to take my mask off using my fingers, take them off from around, and toss it in the trash. And then I will wash my hands. And document the procedure and how the patient tolerated it. And that's the end of the assessment, or the procedure.
Thank you.